Hello, friends. You are welcome to Dr. Mo's blog. I want to first of all start by wishing our Muslim brothers a happy observance of Ramadan. Today, we are going to be discussing a very intriguing molecule, a molecule that has been described by Dr. Nathan Bryan as the holy grail of all molecules. This molecule is a very simple two-element molecule called nitric oxide, not to be confused with nitrous oxide, which is N2O and is laughing gas. Was used as an anesthetic agent. Now, NO, or nitric oxide, is endogenously produced by the body, and it mediates many of the biochemical activities of the cell. Amongst some of the activities that it mediates is one, vasodilation of blood vessels to bring food and nourishment to various parts of the body. So it's the one that mediates vasodilatation, increases the size of blood vessels to any particular organ of interest at any particular time, so that nourishment will be brought to the location and waste materials will be evacuated from such a location. So that's one of the functions. The second function is that it is important in insulin signaling. Now, because it is the only molecule through which insulin tells the body, oh, look, take up glucose. There's enough glucose in circulation, so take up glucose. So without nitric oxide, cells will not be able to take in glucose, and you will have insulin insensitivity, hyperglycemia, and of course diabetes. Based on its activity on causing vasodilatation of blood vessels, it also makes them pliable, and for that reason the blood vessels are elastic, and that helps to prevent hypertension. So when there is a lack of nitric oxide within the circulation, the patient or people may tend to develop hypertension. Another function of nitric oxide is that it modulates neuronal activity. What that means is that it tends to tamper the activity of the nerve cells, preventing hyperexcitability and overfiring of nerve signals. So nitric oxide tends to dampen the hyperexcitability in nerve cells. So another function, of course, which is very important, is that it is responsible for erection in both males and females. That is, erection of the penis and the clitoris in the case of the women. Without nitric oxide, erections will not be possible. Because of its vasodilator activity, it also helps to maintain brain function by increasing or maintaining blood supply to the brain. So when there's lack of nitric oxide in circulation, people may tend to develop neurodegenerative diseases faster than normal. So how is this nitric oxide produced in the body? It is produced by an enzyme called nitric oxide synthetase, N-NOS. Now, there are three isoenzymes of this nitric oxide synthetase. The first one is called E-NOS, that is endothelial nitric oxide synthetase, which exists in the inner lining of blood vessels and mediates vasodilatation. The second one is N-NOS, that is present in the postsynaptic plate of nerve cells, and it's stopped to have a feedback, inhibitory feedback function that prevents the presynaptic junction from over releasing neurotransmitters, therefore having a dampening effect of nerve signals. The third form of nitric oxide synthesis is the inducible form of nitric oxide synthesis, I-NOS. This is found mostly in immune cells. Now it is called inducible because it doesn't function at rest. It only functions, its function is only upregulated when it is induced by cytokines and other pro-inflammatory factors that are released when there is an invasion by foreign organisms. Because nitric oxide also participates in immune function by helping to destroy foreign invaders, because it's a reactive oxygen species, ROS. So these are the three isoforms of nitric oxide. And so you can imagine that whenever the endothelial nitric oxide has a very important function in the body, when you eat and blood needs to be diverted to your intestines, a lot of nitric oxide will be produced by the blood vessels in the intestines, and blood will be diverted there. When you want to think, the same thing happens in the brain. When you want to have sex, the same thing happens in the genitals, and ditto for all organs in the body. So nitric oxide is what performs the function of maintaining adequate nutrition and blood supplies to the various parts of the body when it is required. So that is the important function that nitric oxide performs. I've also told you about the neuronal nitric oxide, its function. So now, the inducible form of nitric oxide is usually produced when there is a foreign invader. Let's say a bacteria invades the body, and immune cells now engulf them, and in response they produce cytokines, and these cytokines will now stimulate the inducible form of nitric oxide synthesis to produce nitric oxide. It produces this nitric oxide in excess, and this will tend to bind with superoxides to form peroxynitrates, which are very harmful reactive oxygen species that help to destroy the foreign invaders. Now, once these foreign invaders are dealt with, it is expected that the cytokine levels will drop and the activity of inducible nitric oxide synthesis will drop, and the levels of nitric oxide synthesis in the system will also drop. So now, what are the sources of nitric oxide in the body? We have talked about the endogenous source, which is the nitric oxide synthesis. But there are exogenous sources, and the exogenous source is what is referred to as the enterosalivary circulation. What happens is that inorganic nitrates that are found in deep green leafy vegetables, when you eat them and chew them, anaerobic bacteria at the back of your tongue will convert the nitrate into nitrite. And when you swallow this nitrite, it goes into the stomach, and the stomach acid reacts with the nitrite and produces nitrogen oxide, which is now absorbed by the stomach and the upper small intestine. So this enterosalivary circulation contributes to 20% of all the nitric oxide in the body. Now, it is called enterosalivary circulation because once the nitric oxide is used by the body, it is converted back into nitrate, and the kidney conserves it in the blood. When it gets to the salivary gland concentrates it secretes it in saliva, and then it is acted upon by oral bacteria. So the cycle continues. The third method by which you can get nitric oxide is through your paranasal sinuses and your nasal sinuses. When you breathe through the nose and you hum or you meditate or do breathing exercises, large amounts of nitric oxide will now be produced, and you inhale them and it is absorbed directly through the lungs. So, why is it important for us to know about nitric oxide? Nitric oxide synthesis tends to diminish with age. By about 40, either due to the fact that we do not engage this system by a lot of activities and exercise, this system tends to become attenuated. Less nitric oxide is produced. And it's at this age of about 40, 45 that you begin to see the signs of nitric oxide diminution. So at this age, men begin to experience decreased libido, erectile dysfunction. Women begin to lose interest in sex. There's a higher incidence of hypertension, higher incidence of diabetes. People begin to have neuronal dysfunction as a result of this lack of nitric oxide. So what can we do at this stage to make sure that we maintain the level of nitric oxide? To maintain the level of nitric oxide, there are three things that you need to do. The first is to make sure that endogenous production is maintained. And this you can do by constantly engaging the epigenetic signals for nitric oxide synthesis. And you can do this by regular exercise. So when you exercise regularly, you will maintain your levels of nitric oxide. Second thing that you want to do is to eat a lot of deep green leafy vegetables. Now, the Western books will be talking about kale, but we have our own deep green leafy vegetables: ugu, uziza, spinach, and all these things. All these contain a lot of inorganic nitrates. And when you eat it, it enhances the enterosalivary circulation of nitric oxide. So you now have enough nitric oxide. Now, in the Western world, it has now been noticed that this enterohepatic circulation of nitric oxide is being hampered by certain practices. One of such practices is the use of a mouthwash like Listerine, which eliminates about 99.9% of the bacteria that is supposed to convert nitrate to nitrite. Another thing that hampers this system is the use of fluoride toothpaste, which also kills oral bacteria. Another practice that tends to hamper the enterosalivary circulation is the use of antacids and proton pump inhibitors, because the acid in the stomach is necessary for conversion of nitrite to nitric oxide. And when you reduce the acid in the stomach by taking antacids and proton pump inhibitors on a long-term basis, the tendency is that your level of nitric oxide will reduce and you'll begin to have the problems that we are talking about. Of course, the next way, apart from exercise and diet, next thing is meditation, breathing exercises, breathing through the nose rather than the mouth. This enhances the alternate pathway for the synthesis of nitric oxide. So if we want to maintain a healthy lifestyle, reduce aging, and all that, we need to exercise, eat deep green leafy vegetables, meditate, and do breathing exercises. All these things, and hum your favorite tools. All these things will increase the level of nitric oxide in the system. Now, is the story of nitric oxide all positive? No. Nitric oxide has also been implicated in disease. Excessive nitric oxide is harmful to the body. Now, let's talk about endothelial nitric oxide. If there is excessive endothelial nitric oxide, let's talk about excess nitric oxide, how this can cause disease. The first disease that excess nitric oxide can cause is septic shock. Now, how can excess nitric oxide cause septic shock? The first thing is that the inducible forms of nitric oxide, when there is a bacteremia or a septicemia, the cytokines that are released will stimulate the inducible form of nitric oxide synthesis within the immune cells. This will produce large quantities of nitric oxide, which will cause generalized vasodilatation. Apart from that, it is known that some gram-positive and gram-negative bacteria also have nitric oxide synthesis. And when they invade the bloodstream, they can also produce nitric oxide. So an excess of this nitric oxide will cause a generalized vasodilatation, and the patient will go into shock, what we call septicemic or bacteremic shock, despite not losing any form of blood. So you can see one of the problems that excessive nitric oxide can cause. Another problem that excessive nitric oxide can cause, particularly within the brain, can cause Alzheimer's disease and Parkinson's disease and Huntington's disease and other forms of neurodegenerative disorders if nitric oxide is high. Now, this high level of nitric oxide is usually caused by high levels of inducible nitric oxide due to inflammation. You know, as you get old, there's this runaway inflammation that is caused by excess exhibition of CD38 cells by immune cells. Now, these cells, when the CD38 receptors on these cells are stimulated due to aging, they will release a lot of cytokines. Now, these cytokines will now go and stimulate the production of nitric oxide by microglial cells and other immune cells within the brain. And when this happens, when there's excess nitric oxide as a result of continuous inflammation, because of continuous inflammation, what results now is that the nitric oxide will combine with superoxide, form peroxynitrite, which will cause lipid peroxidation of neuronal cell membranes and cause neurodegenerative disorders. So while low nitric oxide is harmful, high nitric oxide levels are also harmful. Now, people are now working on drugs that can be used to tamper the level of inducible nitric oxide so that such drugs can be used to cure things like septic shock and neurodegenerative disorders like Parkinson's disease, Alzheimer's, dementia, and Huntington's chorea. So you can see that nitric oxide is really the holy grail of molecules within the body, and knowing about nitric oxide and its function and how to increase the levels of, maintain the levels of nitric oxide in the body through exercise, through eating of deep green leafy vegetables, through nose breathing and meditation and breathing exercises will help to maintain your levels of nitric oxide and will help you to have an increased lifespan, health span, and will reduce the incidence of sexual frailty amongst men and women as the world. Thank you very much. Please subscribe to this channel. Even if you don't like this particular video, please subscribe. Because if you don't like this video, you might like the next one. Subscribe, like, press the notification bell. Thank you very much. See you in the next video. Dr.